Hello and welcome to Embracing Senior Health. I'm your host, Candace Howell. I've got some great guests for you today, and of course we are talking about the importance of senior issues. And with me today I have our Congressman, Tom Rice with the 7th District. Thank you so much for joining us. I also have Charlene Hope and Andrew Mims, and Andrew is the District Director working with Congressman Rice. Some things that are happening on Capitol Hill right now, so very important, especially to what we do here on this show. We're talking about senior health issues. This show is brought to you by Embrace Hospice, and they're doing so much in this community. Congressman, tell us a little bit about your mission and how what you're doing on Capitol Hill affects the 7th District and our seniors.
Well, you know, Candace, first of all, it's my honor to be here, and thank you for having me here today. My focus in Congress has been on getting our economy moving again. That helps everybody. Of course, I work on seniors issues a lot, and I work on veterans issues a lot. My local office here handles specific senior issues, so if anybody has any kind of issue with the federal government, whether it be enrolling for Medicare or Medicaid or filing a disability claim, or if they need passport help or anything like that, they can call my local office, and Andrew Mims here. And Andrew, let's give them the number right up front. What number would they call for that?
Sure. If you are in the PD region, you would call 843-679-9781. And if you're in the Grand Strand region, you would call our Horry County office here at 843-445-6459.
And you know, a lot of times with the federal government and big bureaucracies, people fall through the cracks. And that's when elected officials need to step in. And so we're proud of our constituent service, and Andrew heads that up. We have 3 people who do casework here in Myrtle Beach and 3 who do casework in Florence. And again, we're proud of what we've done. We handle I don't know, 1,000+ cases a month, it seems, and people are pretty happy with what we get done. So we're very results oriented. In terms of senior issues in Washington, you know, I'm on the budget committee, and one thing we face is trying to make sure that all these programs that we have are sustainable. All these trust funds that we have are sustainable, and there's 2 problems with federal government trust funds. One is they're not funded, and secondly, you can't trust them. Other than that, they're fine. But you know, particularly with Social Security and Medicare, these are promises that we have made to our seniors. These people have paid into these programs throughout their lives, as I have. And we need to make sure that they're solvent on into the future. And the truth is that at current rates, they're not. At current rates, both of them, the trust funds will expire within a relatively short period of time, 15 years or so. And does that mean that these programs go away? No, but the benefits will be reduced if we allow that to happen. That's the bad side. The good side is that there are a number of things that we can do to fix it, where it'll be self-sustaining for decades to come. And the sooner we get about fixing it, the easier the fixes will be.
And so let's explain to folks, because a lot of things have changed in terms of health care recently. Obamacare is what we're talking about here, the Affordable Care Act. And there's some things that we want to clarify for the folks at home when it comes to Medicaid and Medicare. So if I have Medicaid, we'll start with this question. Do I need to enroll in the Affordable Care Act or Obamacare? How does that work?
Andrew, you want to handle that one?
In most situations, if the person has Medicaid, there would be no reason for them to enroll in the Affordable Care Act. That's typically because they have coverage through the state Medicaid program and typically some type of Medicare coverage as well. There may be a few exceptions to that, but as a general rule, you would not have any need to apply through the ACA.
And Charlene, real quick, just with tying this to Embrace, how is this affecting the patients that you guys are seeing at your level?
Well, you know, most of our patients, about 95%, are Medicare. One of the biggest problems, and we can talk about that, is Medicare Part D. We as a hospice entity have to now justify why hospice doesn't include some of the medications that aren't related to their hospice diagnosis. So we've had to deal with Medicare Part D vendors a lot, and I can say one of the nurses had a 4-hour session with one yesterday for about 4 patients. So this is just so time consuming, but it's all about getting our patients what they need.
And really confusing, you know, honestly, for the folks at home trying to figure out the difference, Medicaid, Medicare, do I enroll, do I not? And you were about to say something, Congressman.
Well, what I was saying with what Andrew, you know, Obamacare is an effort to try to get more people insured, and Medicaid is a form of insurance, health insurance for people who are indigent or have very low income or very low assets. So if you're covered by Medicaid, then Obamacare is just another form of insurance, and you don't need both.
Yeah, and again, it can be very confusing. So, well, coming up after the break, one of the things that we're going to do is we're going to differentiate even more and boil that down, Medicaid, Medicare, and continue the conversation on Obamacare. So stay with us. We have much more coming after the break. You are watching Embracing Senior Health.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey. Many people think that because you've been referred to a hospice services that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Hello and welcome back to Embracing Senior Health. I'm Candace Howell. We have got some great guests with us today. We're talking a little bit about Obamacare and the Affordable Care Act to really help folks understand some of the concerns there, some things that they need to consider. So I have with us today, we have Congressman Rice for the 7th District. Thank you so much for joining us. And again, we have Charlene Hope from Embrace Hospice and also Andrew Mims. So before the break, I asked you guys the question about if you have Medicaid, do I need to enroll? And it was no, because that's already your form of insurance. So I want to ask you and pose the question now, if I have Medicare, do I need to enroll in the Affordable Care Act?
Generally, no. And the difference between Medicare and Medicaid is that, you know, Medicare is insurance for people who are retired or after age 65, where Medicaid is designed for people who don't have enough assets or income to be able to purchase insurance themselves. So if you meet those income or asset guidelines, regardless of how old you are, you can get on the Medicaid program. But Medicare is designed for retired people.
And one of the other things we were talking about in the break too is Part D. You know, Medicare Part D, talking about the prescription drug program. How does this work exactly so that people understand? Because I think that there's some confusion out there about this.
Andrew, you want?
Okay, well, in Medicare, there are 4 portions. Part A is generally emergency, hospitalization, catastrophic care. Part B is what is closest to general insurance that you would have through a job or an employer or a spouse or something like that. Part C is considered Medicare Advantage, which is where an individual signs over their right to regular Medicare and goes with a private insurer that is approved through Medicare. And then Part D is that prescription drug coverage. Typically, people only have Part D if they have Medicare A and B. If you have Medicare Advantage, it usually includes some type of prescription drug coverage in there. So it's more to help individuals who are going to have a lot of medications, and there's a couple other things that are under there, but to assist with those costs.
And Charlene, how have some of these changes affected what you guys do with Embrace?
Well, up until probably within the last 6 months, patients that were on hospice could get their medications not pertinent to their hospice diagnosis through Part D. No problem. They just go to the pharmacy, they get them filled. Now they're asking for all pre-authorizations. We're filling out many, many forms for our patients so that the medications can be covered. For example, a patient has diabetes, but they're on for cancer. Their diabetes, their insulin, hospice is not going to cover. Part D should cover it, but it's a process for pre-authorization. A lot on our part and a lot on the physicians having to fill out these forms and signing for them.
And a lot of that comes from the cost of instituting the Affordable Care Act. because the administration is using Medicare as a piggy bank to pay for the institution of Obamacare across the board. And a lot of the cuts came from Medicare Part D. So they're looking for ways to save money, and one of these is the administration proposed this year to take, tens of billions of additional dollars out of Part D. Of course, the Republican House didn't accept that. Part D is a very popular thing with our seniors, and we want to make sure, again, that we maintain these popular programs and we make our promise to our seniors good.
Well, and I want to remind folks at home, the 7th District, let's give the makeup of the 7th District just a little bit so that you know that Congressman Rice is your congressman.
7th District is 8 counties. It's Horry, Georgetown, Marion, Dillon, Florence, Darlington, Chesterfield, and I guess that's it. I guess I named them all. And along the coast, obviously, we have the high tourism area. Inside is more rural, and then around Florence and Darlington counties, you have a little more industrial. So it's a very, very widely varied and dispersed district. It runs really almost from Georgetown almost to Charlotte. Wide range of income and asset levels, wide range of skill sets, a lot of agrarian areas, and I'm very honored to represent and try real hard to represent every area and every facet of it.
Well, I know you're working very hard on Capitol Hill, and when you're here within the community, you're always present at events. And I know constituent services is critically important in being a newer district too, so there were so many different things that had to be laid out. Well, we have a lot more coming up within the show, and we're going to dive into a little bit about what happens when you go to the hospital with the Affordable Care Act. We're also going to talk a little bit about HMOs, some advantages and costs and things after the next break. So folks, stay with us. We are chatting about some great issues today with the Affordable Care Act. We'll be right back after the break. You are watching Embracing Senior Health.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
Hello and welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by Embrace Hospice, and we've been talking about the Affordable Care Act today. Have some wonderful guests with us. Congressman Rice is with us for the 7th District today, and he's been telling us a little bit about his travels on Capitol Hill and what he's been working on for the great 7th District. So, Congressman, tell us a little bit about what you've been doing.
Well, the people of this district sent me up there to work on their 3 most important issues, and those are jobs, jobs, and jobs. Mm-hmm. And so the 2 most, the biggest things I can do locally are infrastructure projects with Georgetown Port and I-73. We've worked very hard, and Congress got help in the ports bill for the Georgetown Port and the Charleston Port, because a lot of companies in this district rely on the Charleston Port, and we're closing in on the permit for I-73. But you know, what we're talking about here today in terms of health care affects jobs, jobs, jobs. And the Obamacare, the Affordable Care Act, unfortunately has some disincentives for employers to hire and for people to work, as you were pointing out earlier, with the 30-hour per week rule that, you know, if an employer has somebody who works more than 30 hours a week, they have to be covered. So I've heard from, you know, many dozens of constituents who are saying, I used to work 40 hours a week, I've been cut back to 30 hours a week, and now I'm supposed to now I'm going to be fined if I don't buy health insurance. How am I supposed to be able to do this? And then on the other hand, I've heard from people who are saying, you know, I got 45 employees and I'd like to expand, but I'm not going to do it if I am going to have to be liable for the Affordable Care Act. So it really is it makes us less competitive. It really is a disincentive for people to work, and it's a problem with jobs, and that's what people sent me to Washington for, and that's one of the reasons why I'm so concerned about it.
Well, I'd say it's safe to say you're shaking it up there, isn't it?
Yeah, well, we're trying to. We've gotten a fair amount of national attention. with what we've gotten done for local projects, some of which I mentioned earlier. You know, I've only been in Congress 16 months. We're really, really proud of what we've gotten done. And, you know, we're trying to focus on every group. I'm up there working for everybody. It doesn't matter what, whether you live on the coast or whether you live in the rural areas. It doesn't matter if you're rich or poor. It doesn't matter. I'm working for everybody. I'm trying to lift all boats. And I think the best thing I can do is to help get our economy going locally with these infrastructure projects, nationally with American competitiveness.
Well, one thing I love about what you've been doing in your travels is visiting with veterans, and that's very important to Embrace Hospice and to us here on this show. What are the veterans saying, and what are you hearing in your conversations with the veterans?
Well, it's across the board. You know, veterans are some of our very finest citizens. They're heroes as far as I'm concerned, and they're concerned about it, what every other American is. Our debt, our national debt, and the status of our economy are high in their concerns. And then, of course, you hear all these horrible stories about the Veterans Administration, and that's just a national disgrace. And we've got to do better with taking care of our veterans. And I'm very proud of Andrew and the other people who are doing casework here, because, as I said, when the bureaucracy breaks down, your elected officials should step in and try to take care of that. And I'm proud of what we've done in that regard. But honestly, the Veterans Administration they've got an enormous job, and they do a great job in most cases, but they're breaking down too often. When you hear about this problem in Arizona with these 40 people that died, that is a national disgrace. You know, Mr. Barry Coates here from this district that had problems with his colon and went to the doctor over and over again at the Veterans Administration and kept getting put off, and finally when he did get his colonoscopy 9 months later, he had advanced cancer. You know, these people have stood for us. We wouldn't have our freedom without them, and we've got to do a better job. This is, as I said, it's a national disgrace. Yes,
definitely. Well, and I know that with Embrace, our veterans here and our seniors, this is what we do. We put them first. And you know, the emphasis of this show is to make sure we're focusing on senior health issues and really making sure that our seniors, and not just our seniors, but I need to know what are the issues that I'm looking at in the future as well. And those of us who have parents that are aging, that are entering this time in their lives. So we really appreciate you being here with us today. We've got more coming up after the break, folks. I want you to stay with us here on Embracing Senior Health. We're going to talk a little bit more about what happens if you go into the hospital and you have the Affordable Care Act. Stay with us.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by Embrace Hospice, and we've been talking about the Affordable Care Act today. Congressman Rice is here with us from the 7th District, as well as Charlene Hope and Andrew Mims. And I have a question to pose to all of you regarding the Affordable Care Act and what happens with Medicare when you go to the hospital, okay, because you have an emergency, and the hospital doctor admits you but under observation. What happens payment-wise? I know that there's some concerns here.
And this has become a major problem for a lot of our seniors, especially in this area. When you go in and they put you under observation status, you are not really admitted for a specific issue. So Medicare is not willing to pay for those most of the time. So it's driving up the cost of health care for our seniors because they have issues, but the doctor just won't admit them for a specific thing because they frankly may not know right away what it is. And it's making it to where our seniors are having to pay out of pocket for those initial visits to the emergency rooms.
Which we all know how high those bills can go.
I had a personal experience, my own mother, just before she died, and ended up with thousands of dollars of bills that we were not even aware of.
And a lot of this is because, again, they're looking for ways to pay for the Affordable Care Act, and so they're tightening up rules across the board to save costs. And they instituted this rule called the 2 midnight rule, I believe it is, where as long as you don't stay over 2 midnights, then you're deemed to be under observation status unless there's some other specific issue. And we've co-signed a bill that would do away with that rule in Congress. So.
Well, and I know too, that the hospitals are really efficient with moving people through. And, I think of a specific instance. I know someone recently who ended up in this under observation category because they had a seizure. But if you're not having the event when you're at the hospital, sometimes they can't diagnose. And you go in that observation mode and they're doing EEGs and some of these other things, just trying to determine what exactly happened. So that's a very scary situation. And Andrew, I know that folks can reach out and chat with you if they need to within this district. How do they get a hold of you?
Okay. Well, and again, this is for all of our constituents, not just seniors. Any type of federal issue. And if you don't know if it is, call us anyways. If we're not the people to help you, we will get you to who you need to be with. So again, folks in the PD can call our Florence office at 843-679-9781. And the folks down here in the Grand Strand can call us in Myrtle Beach at 843-445-6459.
I thank you all so much for joining us today. Embracing Senior Health has been a really great show for us because we can really focus on some of the issues that are, important to us all. So, Congressman, thanks for the work you're doing on Capitol Hill. It's critically important. You're representing the 7th District very well, so thank you for your service. Andrew, thanks for the service you're doing with the constituents. And Charlene, I know you guys are doing great work on the street with Embrace. And of course, you can watch us every Friday at noon right here on WMBF News. Thank you so much for joining in, and we'll see you again next time.